This is case of the day, Tuesday, case 129, and it's titled One Last Sign of Spondylolysis. This 48 years old came for an MR, and we can see here that there's lysis, there's foraminal stenosis, exiting nerve root compression, and spondylolisthesis. Now, if you remember about, I think last week, I did this direct and indirect signs where I just went through a bunch of the indirect signs on this, and I used a couple of MRs to run through this. And so if we look at this, all the signs are there. That's the direct sign of lysis. That's the foraminal stenosis. These are all the indirect signs. There is the epidural fat infiltration. So you can see how the fat is contiguous across two levels. There is widening of the AP diameter here markedly as compared to the one above. The posterior vertebral height is reduced. So every possible sign that you can think of is present. Sorry, it's epidural fat interposition, not infiltration. But there's one more direct sign that is gaining prominence, and I think it's worth talking about this, especially after this case that I had done, I guess, about 2.5 months ago, where I talked about this scaphoid fracture that we had seen using an ultra short echo time MR to get a CT-like bone image. And so we had done a CT-like bone image in this patient, or basically an ultra short echo time. My techs love to call it zero echo time, which is it's not truly zero, it's just very, very short. And you can see that on the left as the defect is beautifully seen. On the right, the defect is beautifully seen. I've used 4mm MIPS just so that they smoothen out the image a little. And I saw this here, a piece of bone, probably from the posterior inferior margin, that was indenting the thecal sac but not compressing it. And I couldn't really see it very well on the MR until I retrospectively went back and did that. And I said mainstream because once journals like the AJNR start publishing articles, and this was only for 30 patients, but they talked about using a radiation-free approach with CT-like imaging, and you can see that the quality of the images is pretty much the kind that we have. And this is not synthetic CT. Synthetic CT is using artificial intelligence to get this. This is just a special sequence that, in about 3 minutes gives you a CT-like bone image. And it is a game changer. And one of these days, I'll show what we do with sacroiliac joint diseases. I'll probably do that in a week or so. Whenever I get an appropriate case. So this is becoming more and more mainstream. And there are multiple articles. If you go on PubMed and write bone MRI, synthetic CT, and spondylolysis, you will find at least 10 or 15 articles on this subject showing that more and more people are starting to use this. So now if we have to talk about the signs of spondylolysis, your direct signs would include not just visualization on parasagittal MR, but visualization on a CT-like bone image or bone MR, and those 4 indirect signs remain the same. So if you have access to a UT-ZT sequence, please set up a protocol to add this to all spine MRIs where lysis is suspected, and perhaps in all adolescents and young adults where lysis is typically a top of the list diagnosis, unless you have infection or tumor. And we've done that now. So when we're protocoling in most people now who are young, we're doing UT-ZT sequences. My WhatsApp channel, thank you so much for viewing this.